Hi, my name is Dr. Kim Bird Ryder. I'm a physical therapist and I'm here in beautiful Key West. Welcome. I'm here to talk to you today about an education program for healthcare professionals to learn mindful techniques as intervention. Mindful techniques are things like yoga, tai chi, and meditation. And they can apply them as interventions. So the real question is, are the physicians, the referring physicians, and the patients who are getting the treatments, are they ready for this kind of a treatment? Are they willing to accept it? And the answer is a resounding yes. And it's really at a high point here in 2017. So the American College of Physicians has come out with a study in a guideline, a clinical guideline for back pain, acute and chronic back pain. And they're saying, this is in January 2017, that these are the treatments that you should follow for chronic pain. And that is mindful-based stress reduction, tai chi, yoga, motor control exercises, progressive relaxation. And then after you have exhausted these resources, then you should move on to pharmaceuticals. So you're supposed to be doing yoga and tai chi prior to taking pharmaceuticals for back pain. This is big, this is new. It's so new that all the magazines are picking it up, the magazines that our patients read. And those magazines are things like AARP for our geriatric population. And in April 2017, they have a 10-page article that says the United States of Yoga. 1 in 9 Americans have embraced this ancient health practice. Perhaps it's time to take a deep breath and join in. Consumer Report, 2017, June. They say a kinder, gentler therapy plan, and it's yoga. They're all citing the American College of Physicians with this as well. The New York Times ran an article in February 2017 about back pain, yoga, and tai chi. Our own PT in Motion magazine ran this is about 8 pages, an 8-page article on mindfulness in February 17. It says how it can help patients, PTs, and students. Physical therapists increasingly are using mindfulness in their interventions. New research supports its benefits. So it's really come out in droves this year. Doctors are ready for it, physicians are ready, patients are ready, but are PTs ready? Are healthcare professionals ready to deliver? Are they trained? And the answer to that is absolutely not. There is no program to train healthcare professionals in this country to apply mindfulness practices as interventions, although it's highly recommended by the Physician Association, or the College of Physicians. That's a problem. So, New Grad PT says 30 to 50% of healthcare professionals are in burnout. And we know what burnout means. People quit. That costs the company money, lots of money. Recruiting, training, hiring, a very expensive process. So maintaining your healthcare professionals is very important to the bottom line. So New Grad PT also says that the best way to avoid burnout for physical therapists is to make your interventions fun and interesting to you and to your patient. Right now, our interventions are not that interesting. We do ball squeezes, clams, heel raises. Even TheraBand is not that interesting. As a result, we lose patients, they get bored. We lose PTs, they get bored. And all the other therapists, occupational, PTAs, CODAs, nurses use this for cardiac rehab as well. So there's a plethora of people that are getting bored with the current status quo of our exercise programs. So a lot of these exercises are from the 1950s. Jack LaLanne invented most of the exercises that we use. So it's time to update. And yoga and tai chi offer interest because they're a skill. And they can take this skill and develop it as themselves, as the therapist. The patients can develop this skill. One yoga exercise will travel with you throughout your lifetime. It will change and evolve, and you'll learn more about it. Yoga and Tai Chi are very sophisticated exercises. They can be super simple and taught to anyone, but they will advance with a person as they go through their lifetime, and the qualities of them all change. You can also take it through your lifetime, which is unique. Many sports don't go into old age. Many exercises won't travel into the assisted living facility. But by the way, most assisted living facilities have a yoga in a chair program going on. Swimming doesn't transfer into the assisted living facilities. So this one's going to work. It also is cost effective because there's no equipment. There's no shoes, no clothes. You don't even have to buy a yoga mat. This costs nothing to the practitioner. And it's everywhere. It's in the gyms, it's on TV, it's in books. They can have access to it everywhere they go and continue this skill throughout their lifetime, because that's really what we're after, is to get them to move from therapy or the healthcare profession into independence, but then they have to have maintenance within their independence, and this is a beautiful way to transfer them. So yoga, Tai Chi, those are fun, sophisticated, interesting, multi-dimensional exercises, total body exercises as well. No company offers this type of an education system, which would make us very unique. And unique has pluses that come with it. One is, it's very attractive to new grads. It's a carrot that they will get trained in yoga and Tai Chi if they come to your company, as opposed to, going somewhere else. Also going to decrease burnout within the therapists that are already within the company and offer them something new and novel and interesting. But more importantly is the patients will now have a platform to move into independence. That is the most important thing that we can provide to our patients. This program is already put together. So I've taught a one-day course across the country for the last 3 years to physical therapists, occupational therapists, and their assistants. So I've gotten a lot of feedback from the therapist. And the biggest problem, well, there's two problems. One is you've got to train the entire clinic because everyone has to be on the same page. They all have to understand the same lingo and the same objectives when they write out their exercises, because it's really hard to patient swap unless you do train the entire clinic on this subject. Also, some of those clinicians will be excited to learn something new, and some of them will be afraid. So what I've done with the program is I have piggybacked onto the manual therapy course, because therapists understand the manual therapy courses. Most of them have gone through it, or they're in the process of going through it, or they plan on going through it, or they learned it in school. So this particular laminated set is just on the neck. And at the very beginning is the evaluation. And this is everything we go through with evaluation. They recognize that. They go, oh yeah, this is exactly what I do through my evaluation. Excellent, it's on target. Then, after the evaluation, and you've decided what neck diagnosis you want to address, say upper rotation, C1, C2, and side bending, there's a tab for that, and you could go to that page. On that page, I've put together the manual therapy techniques that we use for this particular diagnosis, and then the exercise that we currently are using coupled with the manual therapy. This is all recognizable to them. Now, this particular exercise, while excellent, will get boring after a while, and they're going to need a more advanced exercise to move into independence. So as the patient progresses, if they turn to the back side of that page, I've put together the yoga exercises that do exactly what the manual therapy and the single exercise we're doing, but in a more complex way, a more skilled exercise type of way. It's just the next progression, and they can see that. And that makes them feel safe. They understand this type of logic. And so it's all here for them, a picture. An interesting picture, not a cartoon. Back to interesting is important. Also to the side, I've left it white so that you can, or we can draw in an extra exercise or notes that we need. There's exercise dosing at the bottom. You can circle how much you want for these particular exercises. If you don't want one of them, I X through it. And then this one copy goes to the patient, and I photocopy this and it goes into their file. And so if I'm working on someone else's patient, I can hit the attachments in the therapy source, and I can see exactly what their page looked like. I'm familiar with this already. And then I can work with that patient very quickly. It's obvious. Also, what I use this for, I carry these around in the clinic all day long under my arm. Because once I've taught a person this, when they come back into the clinic, I say, okay, do your 3 exercises. And this isn't like heel raises. You can't point them into the corner and go do your heel raises. They're going to go, well, I don't quite remember exactly how to do that, because it is a multi-dimensional, more sophisticated exercise. They need to see the picture again. So I'll just lay it down in front of them and walk away and work with my other patient, and they'll go through their exercises. So I don't personally have to do every single exercise over and over and over to show people, and it enables me to work with 2 patients at once, which is mandatory. We have to be able to do that. Also, I teach from this booklet. So when I go in and teach the PTs, we go through the exercises that are in this booklet. We pick them apart. I teach how to do them, and they learn to use the booklet. They become very familiar with it, so they know exactly what to do for what, and they can remember as well. This works in 3 or 4 different ways to our advantage. So thank you for hearing me out, and have a great day.